After 6 on your Monday, both Kentucky and Indiana are seeing levels of COVID spread and serious illness that we have not seen since the surge over the winter months. And our healthcare system across the country is very strained by the number of people in ICUs and on ventilators.
This surge has been more challenging for the hospital industry than the previous one.
Probably the biggest limitation right now is with staff. They're just exhausted.
The National Guard has been deployed in Kentucky to help with COVID response, and the state's requested teams from FEMA to help hospitals that are understaffed. So for our deep dive into the data today, we're looking into the current capacities of our ICUs and how many ventilators are being used right now. We're going to start by looking at Kentucky. Now, as of Friday, there were nearly 1,300 people in the ICU, and that includes both COVID patients, which are the dark blue part of this graph, and the non-COVID patients, which are the light blue part of the graph. But if you add them together, it does mean that almost 70% of Kentucky ICU beds are full right now. It's a little bit better of a situation with ventilators. There are nearly 350 people with COVID on ventilators, around 720 total, but that only means about 38% of ventilators in the state are being used right now. 62% are still open, rather. Now in Indiana, the state's ICU beds are more than 77% full, and about half of the people in the ICUs in Indiana are there with COVID. We have about 23% of ICU beds in Indiana that are able to take in more patients. Again, though, in Indiana, we have a higher percentage of ventilators open. About 29% of ventilators in Indiana are in use right now. About 9% of them are with COVID patients. So that does mean that around 71% of ventilators are still open in Indiana.